Health Disparities and Health Access for Healthy People 2020, Amanda Segovia, Health 415. Health disparities are defined as a particular type of health difference linked with economic, environmental disadvantages, basically groups of people that have experienced greater obstacles when it comes to health-related issues. Some of the health disparities are both voluntary and involuntary, which include health behaviors, lifestyle, genetics, environment, social circumstances, financial resources, medical care, and minority neighborhoods. Genetics has a combination of factors. Lifestyle includes eating behaviors, levels of physical activity, whether you smoke or drink, things of that sort. Medical care, because of the lack of access to quality care and quality care, limited providers with the same ethnic backgrounds. Access to care does not come easy for everybody. It is unequal to ethnicities and minority groups. High cost, they have unmet health needs, language barriers, and there's often stereotyping and biases from other healthcare professionals. More diversity is needed, improving access to vulnerable populations, and increasing the number of ethnic healthcare practitioners are only some of the obstacles that can help overcome access to healthcare. Leading health indicators include access to health services, preventative services, environmental quality, maternal, mental, physical, sexual health, social determinants, tobacco, and substance abuse. I chose to focus on substance abuse. The following is a list of health-related concerns that you can develop from substance abuse, which include teenage pregnancy, HIV, AIDS, STD, child abuse, homicide, and suicide. Here within the state of New Mexico, there is a high DWI rate, and they also have very harsh punishments. The following website, which was retrieved from New Mexico Department of Public Safety, shows the statistics or the high cost of DWI, which can include 6 months to a year of revocation of your license, jail time, interlock for a year, DWI schools, and other treatment services. You can see that they only increase with the number of DWIs that you do get. New Mexico Prevention Services. There's a Total Community Approach Prevention Service, Partnership for Success Grant, and the Substance Abuse Prevention and Treatment, which currently funds 22 New Mexico counties. Here are the counties from the website that they do currently support. You can see that San Juan County, where we live, is one of them. This website will also show the preventative tips, services provided, the training and technical assistance, and additional prevention resources. Going back to the PowerPoint, the New Mexico Department of Health also has a preventative substance abuse program. This here will go towards the health data, resources, and all the related reports consisting of New Mexico substance abuse use and treatment awareness and how they can overcome substance abuse, and kind of like the indicators, Centers for Disease Control Prevention, the NIH also contributes to this as well. Healthy People 2020, in addition to that, some of the programs that help measure the effectiveness of Healthy People 2020 are the NIH, National Institute of Health, the PROMIS, Patient Reported Outcome Measurement Information System, Global Health Measure Scale, and Satisfaction with Life Scale. They all work together conducting surveys, studies, and questionnaires to access how the goal is progressing. The national agenda is to guide disease prevention and health promotion activities in the U.S. over the next decade. Here's a YouTube link regarding the vision for healthy people in 2020 and the goals and their goals, which I'm going to go ahead and leave you with the following YouTube link so you can watch. And thank you so much for your time and listening. And I'm going to leave you with Preparing for the Next Decade, a 2020 Vision for Healthy People.
Our good health is a gift. In the ideal world, all people reach their full potential for health. They reach their highest attainable standard of health, and they really enjoy that gift. But unfortunately, right now, there are too many threats to our health, and people aren't reaching their full potential. So Healthy People reminds us about the importance of prevention. It reminds us about the importance of the gift of health, and it gives us new directions to reach for the future.
Projects like Healthy People are ones that provide a compass. Healthy People gives us an opportunity to say, are we aligned, are our objectives aligned with national objectives? Because we should all be trying to do that.
Well, we have some 4 overarching goals in Healthy People that inspire and motivate all of us. First, to improve quantity and quality of life. Second, to eliminate health disparities and achieve true health equity. Third, to protect health throughout all stages of life. And fourth is to make our environments healthier so that we have a true social determinants approach to health.
The thing that's, I think, is particularly exciting about the new framework for Healthy People 2020 is the additional emphasis on health disparities and health equities, as well as focusing on further upstream preventive measures that can be captured by focusing on social determinants of health.
We're defining health from a public health perspective as including things that you don't usually think of as health, but the conditions that create health.
I think with Healthy People 2020 and our mid-year reports, that if we take these to heart and we look at evidence-based intervention and really connect the intervention with the benchmark from the Healthy People program and evaluate it carefully for its efficacy, that we are really going to make some strong inroads.
So we're really trying to get our practitioners to step back a little bit and look sort of in the classic upstream way of thinking as to what we can do to make our population a little bit healthier.
We're going to need social workers. We're going to need our primary care physicians. We're going to need a whole team to collaborate together to improve health outcomes.
It needs to be an effort on the part of the community, the entire community, the business community, the community of educators. It needs to be a collective effort.
With this new version of Healthy People 2020, we literally want a 2020 vision of health to be shared by everybody in this country. And we want the data and the goals and the targets to be a motivating force for every community and every person in every community.
No, not necessarily, because if you know what the assignment is,